Now, there are women that bleed every 2 weeks, and there are women who bleed almost every 2 months. And the question that most people are not asking is my cycle affecting my fertility? So in this video, let's talk about short cycle and long cycle and what it really means for fertility. Menstrual cycle is being counted from the first day of your period to the day before your next period. And if your cycle is less than 21 days, that's a short cycle. If your cycle is anything more than 35 days, we call that a long cycle. And I know you might be wondering that, but I see my period every month. Isn't that normal? Well, the fact is that even if you are seeing your period every month, it doesn't mean that everything working inside you is working well, and that is where ovulation comes to play. Now, I talked about ovulation because pregnancy can only occur when an egg is being released and fertilized. Now, the process of the egg being released is referred to as ovulation, and most people don't know this, but ovulation occurs 2 weeks prior to your next period, not 2 weeks after your previous period. So it therefore means that if you have a short cycle, for example, the 21 days less cycle I talked about, that means your ovulation is taking place too early, or the eggs that is even being released, the egg that is being released is not fully developed, it's not fully matured, and it is now being released. Do you understand what I'm saying? So does that mean that I cannot get pregnant? Absolutely not. It only means that the chances of getting pregnant is being reduced as a result of the poorly formed egg that is being released. Now, if you have a long cycle, on the other hand, it therefore means that your ovulation is being delayed, or it doesn't even happen in some months. So it's possible that there are months that you do not ovulate. And you might be wondering that, but I bleed. Doesn't that mean I've already ovulated? No, that's not the case. Sometimes you can bleed, okay, without ovulating. So your body can shed the topmost lining or layer of the womb without ovulation occurring. I know that the next question on your mind will be, why does this even happen? But before I talk about that, please let me know in the comment section below. Are you experiencing a short cycle or a long cycle based on what I've talked about and based on your calculations? Is your cycle long or short? Let me know in the comment section below. Now, it's obvious that the next question will be, what causes my cycle to be long or short in the first place? And the simple truth is your hormones. That is a simple answer. Now, hormones are chemical messengers that send signals around the body, and they are very important. You don't even need to know their names, you just need to know what they do. Now, let's look at short cycle, for example. Now, in the short cycle are often linked to the body not producing enough of the hormones that is important and needed to support early pregnancy. That could be a reason why you're experiencing a short cycle. And also stress, thyroid issues, and sometimes age-related changes in the body can cause the hormones not to be produced enough. For long cycle, on the other hand, they are often linked to a condition where ovulation doesn't happen regularly. So any condition that will cause ovulation not to happen regularly, remember, ovulation is expected to occur on a monthly basis if you are in your reproductive years, right? So any condition that will cause this not to happen every month would be a cause of your long cycle. Now, conditions like blood-related problems, that's blood sugar related problems, your hormones being out of balance, because it's very important for your hormones to be balanced. So if your hormones is imbalanced, it will cause it. Also, if you've experienced sudden weight gain or weight loss, these factors are usually responsible for having longer cycles, cycles that are longer than 35 days consistently. Okay, so I'm thinking that the question on your mind would be, should I be worried about this? I mean, I have a short cycle, I have a long cycle, whatever end you fall in, should I be worried about this? Let me answer this question clearly. You should go and seek your healthcare professional if you're having a consistent short cycle. Remember, a short cycle is categorized by any cycle that is less than 21 days. So if you're experiencing that consistently, then you should see your doctor. On the other hand, if you're having a cycle that is more than 35 days to 40 days consistently, then you should also see your doctor. If you notice that you skip your period, what I mean by that is that if you see your period this month, before you see your period again, it's like 3 months time or 2 months time, when you are not pregnant, then you should see your doctor. Also, if you experience extremely painful periods, you should see your doctor. Early checks is very important. It's very important that you check in with your doctor early, or check in with your healthcare professional early, because it's going to save you years of frustration and years of confusion, and it's going to help you just take the necessary steps on time. Okay, now as a way of wrapping this up, I want to say that the menstrual cycle is not just you bleeding every month. Okay, it is actually telling you your overall reproductive state of your reproductive system, and it's very, very important. So if you are having a short cycle or a long cycle, it doesn't mean that pregnancy is impossible. That's the truth. It doesn't mean you cannot get pregnant or you can never get pregnant. It only means that the ease at which you will get pregnant is being reduced. So it's less easier when you're having a short cycle or a long cycle. So it's very important that if you fall into any of this category, go and check in with your doctor. So if you are new here, welcome. Please let me know in the comment section below, have you ever tracked your menstrual cycle length before? If you have done that now, if you have done that in this video, please let me know, is it a short cycle you have or a long cycle, or you have a normal menstrual cycle? Let me know in the comment section below. If you have any question relating to this video, please drop them down below. I will definitely read them and answer them. And also, please don't forget to make recommendations on the kind of content you want to see. Until I see you next time, bye lovelies, and God bless you.